Good afternoon, everyone. I'm Dr. Akhila. Today we are going to talk about pain during menses and how it affects fertility. Uh, so let's quickly start off with what is pain in the first place. Why does it happen? So technically, we call pain during menses as dysmenorrhea. It occurs in about 40 to 90% of the women, and sometimes this can be normal. At times, it can be pathological. So it is very important to understand what is normal, what is not normal. So dysmenorrhea or pain during periods is categorized as primary or secondary. Primary dysmenorrhea would mean that it is not pathological. It can happen even in normal women, and it happens because of production in prostaglandins, and because of the sloughing of the endometrium, prostaglandins are released, and because these prostaglandins cause uterine musculature, that is the myometrium, to shrink, which causes ischemia, and therefore there is pain. So this is normal. Typically, it starts with the onset of period, and within 1 or 2 days, it settles down. So this is not something that we must be afraid of, and it is not. So there's something called as secondary dysmenorrhea. That is, if it happens because of some organic causes, the reasons being fibroids or adenomyosis or endometriosis, PID, if there are any IUCDs inserted into the uterus. These are some of the causes of secondary dysmenorrhea. And when we suspect a secondary dysmenorrhea, the period pain is usually much more severe. They can experience pain even when there is no menstruation. It can be associated with intercourse, pain during intercourse, or pain during passage of urine or motion. And these are some of the indications that can tell us that the pain is probably due to an organic cause. And this is how we differentiate between primary and secondary dysmenorrhea. If it is secondary, the reasons it can cause infertility is because it can affect the intercourse per se. If there is pain, that is one of the first things that can happen. Also, inflammation because of this pain can cause problems in the transport of the gametes through the fallopian tube. That can be a problem. And implantation. So when the embryo is ready, if we are implanting and these conditions are there, that is endometriosis or fibroids or adenomyosis, and you have pain because of these, so the uterine contractions get affected, and therefore implantation also can be affected. So this is how the pain in periods can affect fertility. So it is very important that we understand what is normal, what is abnormal. So there's one more kind of pain that I would like to explain, that is pain during ovulation. If it is not severe, minimal pain can be experienced by about 50 to 15 to maybe 20% of the women. That is again a normal phenomenon. So if this pain is very severe and the female is incapacitated, unable to do her daily routine or unable to have intercourse, then that is something pathological. So this is how we differentiate between what is normal and what is abnormal. So abnormal pain warrants a definite set of investigations and treatment, so we can correct the problem that is there. Normally, scans and physical examination is what we look at, and that's how we can come to a diagnosis. Once the diagnosis is made, the treatment is accordingly. Simple dysmenorrhea, we can give medicines, that is painkillers, analgesics, anti-inflammatories. Most women respond to these kind of treatments, but sometimes a surgical intervention may also be required, or hormone treatments also can be offered to these kind of women who have severe pain and they're not able to respond to analgesics or anti-inflammatories like oral contraceptive pills or progesterones or LNG IUCDs, GnRH analogs. These are some of the other modalities of treatment that are available for dysmenorrhea. So this is in short about pain during periods and how it affects fertility, what is normal, what most women experience, what is abnormal. So one very important point that I would like to impress upon everybody is that most women think that pain during periods is completely normal and they have to deal with it. Some of them experience severe pain and they need not really deal with this pain. They can come forward and look for some treatment options and find out if it is normal or abnormal, and accordingly we can plan a better life for them. Thank you. Any questions, please? Will the pain increase or decrease as I age? Yes. So when there are certain conditions which, even the secondary dysmenorrhea, what we're talking about, it usually comes down with pregnancy in mid 30s, after childbirth. Some of these pains definitely do change. Is it okay to take painkillers during treatment? Definitely, it is okay to take painkillers during periods. There is no problem. It all depends on how severe your pain is, and there's no harm in taking painkillers. Does heavy bleeding result in painful periods? Sometimes, yes, because of fibroids or polyps or cervical issues. Some post-coital bleeding can be there. So painful periods, excess of bleeding can also occur. And this does definitely require a treatment. So when do you call something as a heavy period? If you're soaking a pad or a tampon in about 2 to 3 hours completely, it is soaked, then that is heavy bleeding. If you're passing clots which are more than 1 centimeter, then that is heavy bleeding. So this is something that needs evaluation. Is there a cure to relieve from pain completely? It depends on what is the cause of the pain. Completely cure is not something that I can really answer. But what the pain is, depending on that, we can definitely decrease the pain. And if a surgical treatment or intervention is required, then maybe we are looking at a cure, complete cure. Does painful periods result in endometriosis? Yes, it may be. There is something called as retrograde menstruation, which is one of the causes of endometriosis. Can you explain about PMS, premenstrual syndrome? So there is a certain entity that if you can predict your periods, a regular predictable cycle usually is considered as an ovulatory cycle. So if a woman is able to tell when she's going to get her period, if her symptoms correlate, then most likely her cycles are said to be ovulatory cycles. So this premenstrual syndrome, it depends on how severe the symptoms are again. Severe mood swings or severe pain, unable to carry her daily routines is something which is a syndrome. Otherwise, which normally don't interfere with her daily routine is normal. So I've already explained about PMS. And some of the natural ways of dealing with this PMS is exercise, meditation, yoga, healthy food, healthy lifestyle, regular sleep, some vitamin B1 or vitamin B6, vitamin E, fish oil, all these, are natural modalities to improve your menstrual cycle. Thank you.